Hi, I'm Dr. Brian Kaufman, a retired family doctor and a CLL patient myself, and I'm the co-founder, executive vice president, and chief medical officer in the nonprofit CLL Society. And I'm going to be sharing some of what I think are the most important papers from the European Hematology Association's annual Congress in 2024. The paper I'm discussing now was titled Correlation Between Progression-Free Survival and Overall Survival among patients with relapsed refractory chronic lymphocytic leukemia, small lymphocytic lymphoma, a clinical trial-based approach. I'd like to start with the bottom line. And in this case, the bottom line is that there was a strong correlation between progression-free survival, or PFS, and overall survival, or OS, in relapsed refractory chronic lymphocytic leukemia, small lymphocytic lymphoma. This is especially true for trials with targeted therapies, suggesting at least for those trials of relapsed refractory chronic lymphocytic leukemia, small lymphocytic lymphoma patients, progression-free survival could be used as a quicker but still robust surrogate marker for overall survival. This research was presented by Dr. Vikalp Maheshwari from India, who led an international group of researchers in presenting this publication-only abstract at the European Hematology Association's annual Congress in Madrid in 2024. In the way of background, due to constantly improving therapies for CLL and SLL and better management of the patients overall, patients are now living longer, meaning that waiting for significant difference in mortality between two different treatment cohorts in a trial can take many, many years. The need to prove overall survival can cause significant delays in drug approval and higher costs in drug development, both leading to a possible chilling effect on new therapies becoming available. PFS, progression-free survival, has already been shown to correlate well with overall survival, OS, in frontline therapies for CLL. But there are less data of its value in the relapsed refractory setting, where it could be used to speed up drug research. Let's discuss the methods used. The researchers reviewed 3 of the large medical databases, Embase, Medline, and Cochrane, and they also looked at conference proceedings between 2021 and 2023. To be included, the randomized controlled trials had to report overall survival, which, as you may recall, is time to death, and progression-free survival, which is time to disease progression and/or death, in adult patients with relapsed refractory CLL who were receiving therapy for their CLL/SLL. What were the results? While 25 randomized controlled trials were included in the analysis of progression-free survival as a surrogate marker for overall survival, correlation between 6-month PFS and 12-month OS was overall 5.9, which isn't bad, but it was only 0.24 in the chemoimmunotherapy subgroup, a much better 0.87 in the Bruton tyrosine kinase inhibitor subgroup, and the same 0.87 when you looked at the BTKIs in combination with the BCL2, venetoclax being the only approved BCL2, although others are in development. Let's look at the correlation between 6 months progression-free survival and 36-month survival. Overall, it was 0.72, even better, but a still low 0.35 in the chemoimmunotherapy subgroup, but 0.84 in the BTKI subgroup, and 0.88 when you looked at the combination of the BTKIs and the BCL2 or venetoclax subgroup. So what can we conclude? While the correlation was not tight between progression-free survival and overall survival with chemoimmunotherapy, the overall correlation was significant and positive. It was especially robust for targeted therapies, suggesting that progression-free survival could be a reliable and valid surrogate for overall survival, at least in trials of targeted therapies. while overall survival should remain the gold standard. We can be reassured that progression-free survival could allow for more accelerated approval of relapsed refractory CLL/SLL, providing access to life-saving drugs sooner while confirmatory studies are pending. The link is provided in the written accompaniment to this video. Correlation between progression-free survival and overall survival among patients with relapsed refractory chronic lymphocytic leukemia, small lymphocytic lymphoma, a clinical trial-based approach. Thanks for listening. Stay strong. We are all in this together.